Hello and welcome to another edition of the Morning Update. We're coming to you live from the Information Command Center at the GIS studios with the latest developments from the government of St. Lucia. We continue to watch closely the developments surrounding COVID-19 here on island. And again, we thank you for tuning in to keep abreast as to what's happening here. Today is Monday, the 8th of February, 2021. If you're watching from abroad, St. Lucians in the diaspora and also residents right here in St. Lucia, we do appreciate you tuning in. Things have continued to evolve even this past weekend. We do have an update coming from the Department of Health and Wellness on the latest COVID-19 related death confirmed, as well as other statistics for the past weekend. Also, we have Parliament convening this week, and among the motions and bill to be laid, we will see that the forwarding of an extension of the state of emergency for a 90-day period in the Honourable House. So parliamentarians will be going to the Honourable House this week to discuss the motion tabled surrounding the extension of the state of emergency. We also have the Ministry of Health informing us, just taking a look back at last week, of the soon-to-be introduced Oxford AstraZeneca vaccine here in St. Lucia. We did speak to the Assistant Principal Nursing Officer, Ms. Tekla Jean-Baptiste, just on the weekend, and she did give us some very important information as to what we can expect in the next few months in terms of the inoculation rollout. Also, the further extension of COVID-19 outreach is happening at the VG Sports Complex. We'll give you that information as well as some more bulletin information from the Ministry of Health and other government departments on the other end of this break. Do stay with us. We do have a packed program, and we also have, after this program, the Quayle update coming from Carlton Cyril. So stay tuned to NTN.
Hi, I'm Jim Joseph, President of the Boseju Community Group. We believe St. Lucia can win the war against the coronavirus, and here's how. Every community in St. Lucia must mobilize, coordinate, monitor and support residents the way we would before, during and after a natural disaster. Identify volunteers in your community, assign them roles and deploy them. Ensure your elderly and vulnerable understand all protocols. Help relatives, shield them from unnecessary contact with others. Identify those recently unemployed and vulnerable neighbors living alone. Put systems in place to filter updates from official sources throughout your community. Promote the hotline number 311. If it takes a village to raise a child, then all of us can come together to defend the village against the coronavirus. Let's do it.
Together let us win this war. St. Lucia be a soldier. Together we can beat this corona.
So much for staying with us. If you're just joining, my name is Jessie Leonce, and this is the first live program out of the morning on NTN, and we continue our work in earnest of delivering you the latest developments from the government of St. Lucia. We do have Parliament convening this week, and one of the motions that are expected to be tabled is the extension for the state of emergency to 90 days, and of course we will see a debate in the House surrounding that. But before we get to Parliament, I just want to give you the latest updates from the Department of Health and Wellness. The ministry did inform us of the 19th confirmed COVID-19 related death. And just to give you some information about this individual, death number 19 is a 57-year-old male from the Castries district with multiple underlying illnesses. He was admitted on the 22nd of January, and he was in critical care when he passed away on the weekend, February 6th, 2021. The Ministry of Health and also from us at the GIS, we extend condolences to the family and loved ones of this individual. We also got word from the Ministry of Health and Wellness of some new cases of COVID-19. Between Friday and Saturday, there were the batches coming back of 214 confirmed cases of COVID-19. We've also seen 42 individuals recovering from the virus, and this brings the total number of active cases. When you do the math, the number of active cases stands, well, the total number of cases that have been recorded to date is 2,027, and the number of active cases is 1,091. So right now, 1,091 individuals are being treated. They are in care for the coronavirus, and we do hope that everyone else out there who's going about their day, who's trying to stay in as much as possible, thanks for that. But if you must venture out and go make a living or head out for whatever errand, you do ensure that you adhere to the protocols. The very basic of using the mask on your face, the use of hand sanitizer, copious amounts if you're not near a faucet to wash with soap and water frequently, and also observing the 6-foot distance. It is very important, and it is what really helps in the grand scheme of things at this time. I mean, standing 6 feet from somebody, from other persons, can really make the difference between, you know, a COVID-19 positive or negative. Not saying that it is the only factor or it is the determining one, but it really helps. It contributes toward the overall effort. Now, getting on to the parliamentary sitting for later on this week, there are 2 motions that are going to be forwarded in the Honourable House tomorrow. And just to read a press release coming from Parliament, the sitting of the House of Assembly is scheduled for tomorrow, Tuesday, February 9th, 2021, with papers to be laid by the Honourable Prime Minister and Minister for Finance, Economic Growth, Job Creation, External Affairs and the Public Service. Also the Honourable Minister for Commerce, Industry, Enterprise Development and Consumer Affairs, and as well as the Honourable Minister for Tourism, Information, Broadcasting, Culture and the Creative Industries. The motions down for consideration are as follows. Be it resolved that the Parliament approves the declaration of a state of emergency that was published in the Gazette on the 3rd day of February 2021 as statutory instrument number 27 of 2021, containing a declaration that a public emergency has arisen and as a result of the occurrence of the 2019 nCoV, an infectious disease commonly known as COVID-19, for a further period of 90 days commencing on the 11th day of February 2021 and ending on the 16th day of May 2021. So these are the projected figures for the 90-day state of emergency here in St. Lucia, and the ministers of government will be going into the House to table this motion. We also have another motion, be it resolved that Parliament by affirmative resolution approves the draft value added tax. That's the amendment of Schedule 3 order, which amends Schedule 3 of the Act to exempt imports of personal items, food, clothing, toys, and other household consumables contained in barrels for the period 1st February 2021 to 31st March 2021. The bill that is down for consideration tomorrow is the COVID-19 Prevention and Control Amendment. Tuesday's sitting is scheduled to commence at 10 a.m. Of course, Carlton and myself will be down there from around 9 a.m. We will go live at 9, so you can join the live broadcast for some discussion on what the public can expect to transpire in the Honourable House, getting more into the meat of things in terms of the legislation surrounding the state of emergency. Also, the motion for the approval of the draft value-added tax and the COVID-19 Prevention and Control Amendment Bill. We continue with the news this morning of the Ministry of Health soon to introduce the Oxford AstraZeneca vaccine here in St. Lucia. The ministry did receive confirmation from the Pan American Health Organization of the allocation of 74,400 doses of the Oxford AstraZeneca COVID-19 vaccine, and this will be received through the COVAX facility. The COVAX facility facilitates the distribution of the vaccine in a manner that is fair across all countries globally, irrespective of size or development status. Tekla Jean-Baptiste is the Assistant Principal Nursing Officer and also the Immunization Manager in the Ministry of Health and Wellness. I did get an opportunity, myself and colleagues Lisa Joseph and Carlton Cyril, on Saturday to speak to Ms. Jean-Baptiste, and she did give quite extensive information in terms of what we can expect. She did indicate that from the time the first batch of vaccines land in St. Lucia, the effort is to get at least 20% of the population vaccinated in about 2 to 3 months. Get this latest update from Mr. Batiste.
The AstraZeneca vaccine offers many advantages for its introduction into St. Lucia's vaccine program. One of the greatest advantages of the AstraZeneca vaccine is it does not require ultra-cold storage. Rather, it can be stored within the refrigeration system that is used for vaccine storage within our national healthcare system. In addition, the rollout of the vaccination program can be conducted in a similar manner to how vaccines are currently given to our population. That is, the vaccine can be given both within the healthcare institutions as well as within non-health sites, including workplaces and community settings.
And of course, the projected timeline for receiving this batch of vaccines is the end of February 2021. It is estimated that this initial allocation will allow for the vaccination of 20% of our population, and thus commencing the process of building immunity against the COVID-19 virus, and by extension, strengthening the public health efforts to manage COVID-19.
The St. Lucia Cabinet of Ministers has agreed for this vaccine to be made available at no cost to citizens, and it shall be provided on a voluntary basis. The national COVID-19 vaccine program shall be rolled out through a phased approach, with the first phase focusing on people at greatest risk of COVID-19. This shall assist in protecting those with greatest vulnerability and likely to have more adverse outcomes if infected by the virus.
And officials in the Ministry of Health will be providing further updates and guidance to the public as they prepare for the introduction of the COVID-19 vaccine. Just to go back to Saturday's interview that we had with Ms. Tekla Jean-Baptiste, she did indicate that a sensitization effort will soon be underway as well, certainly understanding the COVID-19 virus as well as what the vaccine is going to do in the various communities. So we definitely are on standby from the Ministry of Health ahead of the vaccine arriving in St. Lucia, word on this and being able to penetrate the communities for greater awareness and understanding of even specifically the Oxford AstraZeneca vaccine coming to St. Lucia. Do stay tuned. We have some more news, some bulletin information from the Ministry of Health on visiting hours at the OKEU hospital, as well as the extended outreach that is happening at the VG complex. So many persons would have gone there to be assessed and tested for COVID-19. That is being extended. So if you have any symptoms or if you have any concerns, that is one of the places you can go to. We'll give you some more information on that in just a bit. And also, we're hearing from NEMO. We know that the passes which were issued last year, some persons still have it, but we have an update from the NEMO director. She will be speaking specifically to those passes and letting you know what you need to do in terms of this state of emergency and being ready for traversing via NEMO in this state of emergency. So stay with us. We have that on the other end of this break.
Virus ready to harm us. Panic is not the answer. We can win this together.
Often use hand sanitizer, better yet use soap and water.
We must protect each other if we are to beat this corona. Together let us win this war. Be a soldier for St. Lucia. Together let us win this war. Be a soldier, together we can beat this corona.
So you don't become the next case. Avoid touching your face. I'm sure you've been told so. Handshakes and hugging around, no, no.
Advice give you the please. Cover your mouth and your nose if you cough or sneeze.
Practice social distancing and avoid large social gatherings.
Together let us win this war. Be a soldier for St. Lucia. Together let us win this war. St. Lucia, be a soldier. Together we can beat this corona.
For further information, please contact the hotline at 311 or the Bureau of Health Education at 468-5349.
Thank you so much for staying tuned. If you're just joining us, welcome. You are watching the morning update live on NTN. We're coming to you from the Information Command Center at the GIS studios. More news for the extension of COVID-19 outreach activity at the VG Sports Complex. We got that update from the Ministry of Health over the weekend. They did indicate that as part of efforts to continue providing coverage of COVID-19 testing within the Castries-Gros Soleil Basin, the Ministry of Health has extended its mobile testing activity at the VG Sports Complex in Castries. Now, persons with respiratory illnesses, respiratory symptoms, and those who are referred from contact tracing can access the COVID-19 testing at this site from Monday to Friday from 9 a.m. to 4 p.m. daily. All coming to this location are required to bring a valid form of identification. The mobile testing activity will also focus on health education on the COVID-19 virus, including the promotion of infection prevention and control measures. For individuals who have done a COVID-19 test at the VG Sports Complex, you will be contacted by the community nursing service with the results, and in the interim you are asked to remain in quarantine until contacted via telephone by a healthcare worker. The Ministry of Health thanks everyone for their cooperation. So there you have it from the ministry, extending the opportunity to go to the VG Sports Complex as they continue their COVID-19 outreach activity. Testing continues there, also sensitization, letting you know what you can do to continue to protect yourself from contracting the virus. Earlier on Friday, we did also receive another press release from the Ministry of Health and Wellness with respect to visiting time at the Owen King EU Hospital. As part of the strategy to manage and control the increase of COVID-19 cases, the Ministry of Health and Wellness informs the public of the following. So, visiting time at the Owen King EU Hospital on a daily basis is limited to half an hour. So from 6 a.m. to 6:30 a.m. and at 12 p.m. to 12:30 p.m. Only one visitor will be allowed at a time to see the patient during the 30 minutes visiting time. Absolutely no evening visiting hours are allowed until further notice. Effective Friday, February 8th, 2021, I believe that they wanted to have made that Friday, February 5th, 2021. All outpatient clinics at the Owen King EU Hospital visits will only be conducted by scheduled appointments. A hospital clerk will be contacting you with your new appointment. Please adhere to the new given appointment date and be on time. Only emergency and urgent surgeries will continue at the Owen King EU Hospital. Please note, everyone coming to conduct business at the Owen King EU Hospital during the COVID-19 pandemic must wear a mask amid the other applicable rules. Management encourages the public to wear this mask and whenever visiting the hospital. The Ministry of Health will continue to take the necessary measures to ensure the health and safety of staff and patients during this pandemic. So these are the two major bulletin information that's coming out from the Ministry of Health and Wellness. And now from the NEMO, from the National Emergency Management Organization, the NEMO is informing the public that the green passes that were issued during the first shutdown in 2020 have been recalled and are no longer valid. Doreen Gustave is the director at NEMO, and she did speak last week to this matter.
The National Emergency Management Organization, NEMO, wishes to inform the public that the green passes that were issued during the initial shutdown in 2020 have been recalled and are no longer valid. As such, this pink pass has replaced the green pass, and it is the only pass that the police will recognize. Also, letter passes are being issued to persons who are permitted to be out during the curfew hours 7 p.m. to 5 a.m. and expires February 10, 2021. I would like to appeal to the public to please restrict your movement. Those persons who have been issued passes you are to use the pass for only the purpose that it was issued for. Persons who wish to request a pass, please send an email to NEMO at this address: admin, admin@nemo.gov.lc, and also training@nemo.gov.lc. Let us all play our parts in following the protocols that have been established. Wear your mask, sanitize, physical distance, and in this way, we all will work together in achieving our goal in reducing COVID-19 in St. Lucia. Thank you.
Now, from NEMO, the director at NEMO there, Mrs. Doreen Gustav, on to the Department of Finance. As St. Lucia experiences its third and biggest wave of the coronavirus thus far, and also with the government announcing more stringent measures, the Department of Finance has in turn stepped up its own compliance and communication efforts as it's related to the COVID-19, the established COVID-19 protocols. In this regard, a video explaining the department's COVID-19 preparedness and response plan has been created and widely circulated to staff and the general public who access the Finance Administrative Center. We have more in this report from Glenn Simon. Take a look.
And I am Stanza Delikni, and we are
Police COVID.
The Department of Finance has created an explainer video that highlights the protocols outlined in the department's COVID-19 preparedness and response plan. Though the plan was prepared and circulated to staff in April of 2020, management realized that not many staff members were familiar with the protocols and thus embarked on the production of a video as another layer in their communication strategy. Nicole Jean-Jacques, Acting Deputy Director of Finance with responsibility for administration, stated that the protocols were established to ensure the continued delivery of critical operational services, business continuity, and to provide clear channels of communication.
We realized that it was a 10-page document and staff don't read as we would like them to read. So it was like a visualization of the hard copy document right there in their face, to have access to it, to be there as a reminder as to what to do when they come into the work environment in the physical setting.
She said the video was well received by staff, who themselves are on high alert, having been affected by both suspected and positive COVID cases within the building.
Well, every staff member from top management to the line staff are on board, including security. Even those members of staff of the government service who's part of economic development, they're also on board with us in ensuring that everyone is safe in the building while they're there working or just visiting on business.
Some staff members commented on the impact of the explainer video, which is laced with moments of levity.
6 feet, have to be accurate.
Well, I saw the video and I was quite pleased with it. In terms of the relevance of the video, I mean, right now we all know what's going on with COVID and everything, and there's never something like too much information. So the more information that we get, or which is given to the public, I'm hoping that they can take it and use it.
I think the visual, sometimes we hear a lot of stuff and sometimes it's good to be creative. So that creative initiative, I think, will have a very positive impact on the minds of our officers in the building, to allow them to continue to practice safety protocols for the control of the coronavirus.
I think the video is excellent in giving us diversification in our communication of this important and pertinent guidance and guidelines.
We have so much reading already, and to be reading protocols and trying to follow it, I think it is more feasible for to have a video. The acting as well as the message in the video is a lot clearer when you hear it from your own colleagues.
The video highlighted scenarios such as a symptomatic employee in the workplace or at home, or who was a contact of a positive case. It also addressed the sensitive issue of children in the workplace.
when you surprisingly, when you go around the public, general public, you're hearing that St. Lucians don't observe the protocols established to keep them safe. So I'm hoping that this actually sticks in the minds of our employees, and when they go home, they're able to share it with their immediate friends and families.
The Department of Finance is hopeful that this initiative and modality of communication will be replicated within the private and public sectors to drive greater compliance of the COVID-19 protocols. The video was presented by Javan Lewis from the Department of Finance and Stanza Deligny from the Department of Economic Development. Reporting for the National Competitiveness and Productivity Council, I am Glenn Simon.
Thank you, Glenn Simon, for that insightful report. We are due for a break. When we come back, we have some more bulletin information, this time from the St. Lucia Air and Seaports Authority, as well as a vaccine update coming up at 12 p.m. We want to let you know more about that, as well as some events surrounding our Independence Day activities. Stay tuned for that and more coming up after this break.
Yeah, my G. Yeah. The road clear, my G. Do road.
I don't feel now is the right side.
Are you mean by the road clear, my G? Do road 120. Yeah, man. That's how we do it. Like real boss. Boy. Yes, that. Watch it.
Don't fall victim to peer pressure when driving. Your life and the lives of others are your responsibility. Drive safe. Arrive alive.
Thank you so much for staying tuned. This is the morning update live on NTN. We're coming to you from the Information Command Center of the GIS studios. My name is Jessie Leonce. If you're just tuning in, we continue with the latest developments coming from the government of St. Lucia. At 12 p.m. today, we have a vaccine update from the Ministry of Health and Wellness. They will be coming into studio at 12 p.m. to speak, to have a press briefing, a press conference to speak on the latest information surrounding their inoculation exercise coming in the coming weeks. As I mentioned earlier, and as you heard from the Assistant Principal Nursing Officer, Ms. Tekla Jean-Baptiste, the effort right now is underway. There are preparations being made not only for the vaccination drive, but it also includes sensitization to ensure that the public understands what is happening, what the vaccine will do for the population at large as we continue in the fight against COVID-19. Oxford AstraZeneca 74,400 doses coming to St. Lucia, and it is hoped that this, which will be coming in batches, this will be able to fortify and vaccinate the 20% of the population within 2 to 3 months. That is the effort from the department, as per word from Ms. Tekla Jean-Baptiste. So that, and also an extension of that, some additional information will be given as it pertains to the vaccine coming to St. Lucia at 12 p.m. The Ministry of Health officials will be coming in studio to go live to speak to the viewership on their work so far. We also want to let you in on an address by the Prime Minister, Honorable Alan Shasney, themed "We Can, We Will," and it will be airing at 8 p.m. So 8 o'clock this evening, that is today, Monday, the 8th of February. It will be aired on NTN, also the Government of St. Lucia Facebook and YouTube channels, and participating local media. This will be followed by the launch of the Independence, a slate of activities that you can expect in the coming weeks. So be sure to tune in to NTN, the Government of St. Lucia Facebook and YouTube channel, and also the other participating local media for the address from the Prime Minister, Honorable Alan Shasney, under the theme "We Can, We Will." Continuing for the morning, we do have the Prime Minister again fulfilling his promise to resolve the issues confronting the Ezra Long Laboratory due to the increase of COVID-19 cases here on island. The lab has been weighed by the volume of samples for testing and processing as well. And during his address on Tuesday on the new protocols, Honorable Shasney informed that the forensic lab will now receive samples from 2 of the largest facilities, that is Viewfort and Grossley Polyclinic clinic for processing. This is to reduce the backlog that we've so far seen in the last few weeks and the burden overall on the Ezra Long laboratory.
Our country will go back to a state of emergency effective Wednesday, the 3rd February 2021, for an initial period of 7 days. This will allow us to further restrict movement with a curfew from 7 p.m. to 5 a.m. effective Wednesday, the 3rd of February. Antigen tests will be used for screening in high-risk settings and workspaces. Training on antigen testing began today. Exit tests for travelers will be facilitated at private laboratories. Mass testing will be introduced to increase population coverage. In light of increasing cases and community spread, 2 additional wellness centers will be used as testing sites, one in the south and one in the north.
That was the Prime Minister, Honorable Alan Chasney. Nationals will also have the option of testing at private laboratories as well. And now to word from the Chief Medical Officer, Dr. Sharon Belmar-George. And we would not have seen as much of her in the last week as we usually do, and there was some concern. She did go onto her social media platform to assure St. Lucians that she was well and working assiduously. The effort was continuing in earnest from her office in the fight against COVID-19, and that she was well and she was not being seen, not because she was sick or anything, but because she was definitely working very hard. And speaking of which, more updates on the COVID-19 situation. Additional cases of the new variant had been confirmed last week. The Ministry of Health and Wellness last week did indicate that it received confirmation from CARPHA, that is the Caribbean Public Health Agency, of 5 cases of the SARS-CoV-2, that is the British variant, diagnosed in country. The United Kingdom Public Health Agency reported the variant of SARS-CoV on December 14th, 2020. However, the identified strain had been in circulation from September 20th, 2020 within the United Kingdom. The risk of importation into the Caribbean and the rest of the world was rated as high due to incoming travel from the United Kingdom and Europe. Now, Chief Medical Officer Dr. Sharon Belmar-George in the Ministry of Health and Wellness did speak at a press conference held last Wednesday, noting that at least 6 new variants of COVID-19 have emerged.
COVID-19 is not behaving any different to viruses. Viruses are simple organisms. They are known to mutate frequently. So this is not unusual. Just as we see influenza mutates every year we need a new influenza vaccine. It's a similar case that's happening with COVID-19, where it mutates, it changes, and some of the characteristics of the virus also change. So in December, we were alerted, the world was alerted on this new variant. What they noted on the variant, and let me also indicate that they also made it clear that this variant was circulating from September. So it was a lot of months when this variant was already, it already existed. So what the analysis indicated, this most likely is already everywhere. We were alerted in December, but it was already everywhere since September. So that's like 4 months that it was, the countries were open. So the likelihood, the risk of it being in other countries was very high, and some countries quickly started testing and noted that they did have it in circulation.
The cases confirmed in St. Lucia consisted of 2 British nationals who were diagnosed on December 17th and December 23rd, 2020, and 3 St. Lucia nationals from the Dennery, Micoud, and Babono districts who were diagnosed in December 2020 as well. All 5 of these cases have since made a full recovery from the COVID-19 virus. A studies conducted in the UK on the new variant of the virus suggests that it increases the rate at which the virus spreads. Dr. Belmar-George did explain this.
Of significance of this variant that they noted was the fact that the transmissibility was high, 70% more. So that is, when, for example, we would note with 1 person getting COVID, we get 1 or 2 cases. If it is easier to be transmitted, it means for every 1 case, we expect to see more persons developing the illness. What the research is showing to date is that the form of the disease is not more severe. That is, it is affecting people the same way. So the death rate is not more. The signs and symptoms are not more severe. It is not killing people more. People are not suffering more with it. The only change that they have noted at this point in the research is that it is transmitted faster.
The Chief Medical Officer did note that there is no evidence at this point of more severe cases associated with the new variant or it reducing in effectiveness of the COVID-19 vaccine. While the PCR test is able to detect the virus, a gene sequencing test is needed to detect the new variant. The region, however, does not have the capacity to do the gene testing to detect this variant.
CARPHA indicated that they will accept samples when we get positive tests with very high viral loads. They gave the countries an allocation that we can send, and it has to meet a certain condition for it to be sent over to them so that they can test. CARPHA facilitates the countries. CARPHA is not able to do the gene sequencing, and they outsource it on behalf of countries. So there is a delay in countries getting the results.
Chief Medical Officer Dr. Sharon Belmar George. CARPHA is the regional reference lab with the capacity to perform gene sequencing for the region and does gene sequencing for the gene variant for all its member states. It has allowed countries to send an allocation of 10 samples per week, which meets the requirements for gene sequencing. The process of this mechanism has a turnaround time of about 3 to 4 weeks. At this point, we want to take a break. When we come back, we have an update from the St. Lucia Air and Seaports Authority. Stay with us.
Overnight, growing national unrest.
Society, a digital cashless society, one world currency.
A vaccine for COVID-19.
Droplet
COVID
virus. Macy's iconic flagship.
Virus
the
coronavirus.
Everybody vaccinated.
On the pandemic.
Opposition to the lockdown.
An infected conspiracy theories.
Bizarre claims.
It's a the origin of COVID-19 hidden from the rest of the world. And the Chinese.
In this constantly changing environment, resulting in sensory overload, cut through the noise and tune in to the National Television Network, the official source of information, all facts.
Thank you so much for staying tuned. And now an update from the St. Lucia Air and Seaports Authority. But first, if you're just joining us, a special good morning to you. We'd like to let you know that while we're coming to the end of this morning's first news update, we do have the Quayle update coming from Carlton Cyril this morning, and he will be speaking to you in Creole, giving you all of the latest updates, if that is, of course, what your preference is. We have an update from the St. Lucia Air and Seaports Authority. I just want to pull that up for you. Very important in terms of going out to the ports to conduct your business. And the press release reads as follows. The St. Lucia Air and Seaports Authority, SLASPA, advises that as an essential service business, operations continue at both Viewfort and the Castries seaports. As such, customers should make an appointment for delivery of cargo. To make an appointment for the clearing of personal effects, cargo, customers should make an appointment. Customers are to contact SLASPA Monday to Friday from 8:30 a.m. to 12 noon and 1:30 p.m. to 4 p.m. at the numbers 285-1091 or 285-1175 via WhatsApp. So the number you can contact them by is 285-1091 or 285-1175 via WhatsApp. The following items must be provided when booking an appointment: the bill of lading number or delivery number, the customer name, the identification card, the mobile telephone number of the customer, number and the vehicle registration number for pickup of the pickup vehicle. COVID-19 protocols as established by the Ministry of Health and Wellness will be in full effect. Face masks must be worn throughout the clearing process and bandanas are not permissible. Strict adherence to the port rules will be enforced. You are reminded that no children will be allowed at the port, one person per transaction, so don't bring any other individuals with you. Their pregnant women and elderly citizens are encouraged to utilize broker services. Persons should be modestly dressed and no disorderly conduct. The authority is prepared to serve you with excellence and encourages everyone to adhere to the protocols for the safety and well-being of all port users. So that latest update there coming from the St. Lucia Air and Seaports Authority. Of course, as you've seen throughout this morning's program, many government ministries, government departments are adjusting their operations to ensure that they are in adherence with the changing protocols, adjusted protocols. We're now in a state of emergency, and of course, as we mentioned earlier, the Parliament will be going to the Honourable House. Parliamentarians will be going to the Honourable House tomorrow to table the motion for an extension of the state of emergency for a 90-day period all the way into May. And so definitely the government ministries, government departments are adjusting their operations in adherence with these protocols. Just want to go over some of the other information that we have been bringing you this morning. We know that at 12 p.m. we want you to stand by. For 12 p.m. the Ministry of Health and Wellness will be having a press conference live from the Information Command Center right here at the GIS studios to speak on the vaccine rollout. So we will be getting an update from the health officials on the vaccine program, or what shape it will take, or whatever information they will be providing at 12 p.m. today. This evening, we also have an address being presented by the Prime Minister, Honorable Alan Shastney, and he will be presenting, I believe that is before the launch of the independence activities that will be launched later this evening. So quite a packed day. We have this morning with the updates, midday with the update on the vaccine, and later on this evening you will be hearing from the Prime Minister, Honorable Alan Shastney, in the lead up to the independence activities launch. We also do have some updates, as I mentioned earlier on, from the Department of Health and Wellness in terms of the visiting times at the OK EU Hospital, 6 a.m. to 6:30 and 6 a.m. to 6:30 a.m. and 12 p.m. to 12:30 p.m. And also effective Friday, 5th February, all outpatient clinics at the ON King EU Hospital these visits will be conducted by scheduled appointments only. So you can't just show up to the OKEU hospital right now, as they are considering the health and wellness of not just their staff and their clients, but also the public at large. You need to make an appointment before you visit the outpatient clinic. And also only one visitor will be allowed to see patients. So visiting hours, only one patient will be allowed to see the patient during the 30 minutes visiting times that I mentioned earlier. Also, from the Ministry of Health and Wellness, they have further extended their outreach activity for COVID-19 testing and assessment at the complex, the VG complex, so you can still go out there to ensure that you can get tested and just be reminded of some of the basic protocols associated with the COVID-19 response here in St. Lucia. And speaking of vaccine, I just want to bring you in on this. A special good morning to you, Mr. Carlton Cyril. I hope you had a good weekend.
Oui, Jessie, bonjour. Toujours un plaisir pour ici à Centre Camarade Information. Non, moi c'est Carlton Cyril. Nous avons information sur le développement qui a fait dans cette liste en créole. Nous avons dit bienvenue pour vous écouter nous l'autre pays en Caraïbes, n'importe côté où vous voix nous. Nous avons apprécié, nous avons dit bonjour pour vous et pas fait dernier fois. En chai développement, ou quand ils savent parler du vaccin, nous allons parler un petit peu sur ça. Gouvernement, le Parlement, ka jwen demain kay konsit ou kay savan chay parler di état de secours nous hatten parler pour y aller pour 3 mois nous tenir pour 7 jours et qui ka bout demain quand un gouvernement ka vie aller en kay konsit pour une permission et bien là pour ajouter pour un lot 3 mois. Parmi l'autre développement aussi, là il vient pour un chay notice nous attend, là il vient pour l'hôpital là, moi kay parler de ça ou qui a visité moun qui malade là, yo jamais été weg qu'on y poursuivre ces weg ça. Nous attend aussi, là il vient pour moun yo ka voyer tester la vie en sportive complexe là, yo ka dou ça même a trouvé koy ajouter. Là il vient pour ces baouya nous t'en parler di concession à sous baoui, yo ajouté à sous ça slash pas ka bay moun jid gouvernement développement premier ministre Saint-Lucie Alan Chasneni pour adresser nation ça kay fait à 8h au soir qui commando souple ou pour veille à sous télévision channel 122 et ben ou qui a sur internet là ou ça veille là vini pour adresse Facebook puis YouTube vous savez ça sur internet là et puis l'autre média qui a associé et puis nous ici à Conchai bon matin et nous commandons pour wete et puis nous quand nous kay entrer en dedans ça tout bonnement quand vous voyez pour de Jesse oui week-end pas tenir j'ai pour parler dit puis travail qu'on la coutume mais il était bon tout bonnement il était bon tout bonnement.
Well, you know, I brought you in as we came on this vaccine juncture in terms of me wrapping up because we did have the opportunity to speak over the weekend during our weekend wrap-up with the immunization manager, and she's also the assistant principal nursing officer, Ms. Tekla Jean-Baptiste, and she did give us quite a bit of information on the inoculation program, letting us in on, you know, how the 74,400 doses will be given out, and of course during the course of a 2 to 3 month span. And she also indicated that, you know, it is free, it is giving out on a voluntary basis, but most importantly is the registration process that will be involved. So if you want to be vaccinated, she did indicate that there is a registration, a pre-registration process that is involved. So if you want to be vaccinated, you can go to your community clinic and inform them, alert them, let them know that you are interested in being vaccinated for COVID-19. 74,400 doses of the Oxford AstraZeneca vaccine will be in St. Lucia by, well, in a phased approach, start coming to St. Lucia by the end of February, and the hope is to have about 20% of the population inoculated within 2 to 3 months. So of course there will be priority given, folks, to people who are at greater risk.
Oui.
Our frontliners.
Oui, et puis ça c'est bonne nouvelle. Quand on dit nous te parlé Tekla Jean-Baptiste là, il c'est yon qui a travaillé là, il vient pour monde qui supposé qu'a fait vaccin. Nous avons une confirmation parmi l'autre bagaille dit date qui nous avons 74 400 en ces vaccins ça. Yon dans ces bagaille là il dit Jesse qui était bien important, nous pas qu'à tout là même. Yo kay fait dans phase nous kay suivre yo en midi yo kay ni ces vaccins là pour monde qui kay vle quand kay savent c'est moun qui plus vulnérable parmi nous, il dit nous ça c'est moun plan, c'est pour faire assurer c'est moun ça haine, c'est gens qui directement involvés, ça c'est moun qui c'est travailler essentiel en police, nos docteur qui directement involvé puis public là et qui a fait travail ça parmi moun qui kay haine premier, mais il était bien il prend temps et il dit nous les venir pour chaque monde qui a parlé dit est-ce que yo kay point yo pas fou ben vaccine ça il y a les pour dire ici yon qui a un stamp WHO qui organisation qui responsable pour santé la terre yo jadi AstraZeneca ça ici yon qui bon quand ou encore avec Jesse parler de ça les il vini pour ces premiers 7 c'est moun qui plus vulnérable di nous kay joindre puis c'est moun travailler essentiel là encore il parlait di ou qui voulait oui s'ouvrir vaccin ou ça commencer ou faire registration et puis ces gens dans ces cliniques là qui plus pour là aller là dit yo kay vle point non parce que ça moi c'est Jean-Baptiste dit yo pas ni vle moun ka combler tout moun anik tout bout et ça nous empêche c'est si manger quoi si on non là yo couyo c'est là où kay ça venir.
Absolutely. Cooks, I definitely look forward to your program this morning in terms of giving the people some important updates in Creole. I just want to leave you all with this important update, the last from the Ministry of Health and Wellness. The 19th COVID-19 related death has been confirmed. We received word just last night from Ministry of Health and Wellness on this. A 57-year-old male. He did have underlying illnesses, and of course there have been new cases. The number is 214 new cases of batches returning between Friday and Saturday this weekend. And we have some persons who have recovered. 42 individuals have recovered, bringing the total number of active cases to 1,091. The total number of cases St. Lucia has since had since March last year is 2,027. Please take note of this information as we go day by day, watching closely the COVID-19 situation here on Ireland. As such, we have tomorrow Parliament convening. The House of Assembly will convene to table two important motions, one of them being the motion to have the state of emergency roll out for 90 days. That is going into May. And also we have the bill down for consideration is the COVID-19 Prevention and Control Amendment Bill. And of course this has been gazetted. And we will be hearing from the parliamentarians, their views, their positions tomorrow. We invite you to tune in live. We'll be live from 9 a.m. speaking on the COVID-19 situation, as well as delving in deeper with respect to the state of emergency legislation and what it will mean for everyday St. Lucians. So Carlton and myself will be coming to you live from Parliament Building tomorrow. And we do hope that you stay tuned for the day for the proceedings to hear from the representatives what they have to say on the state of emergency legislation. With that, I wrap up. I'd like to thank you so much for watching another day where our work continues in earnest to bring you the latest developments from the government of St. Lucia. Do enjoy the rest of your day. I remind you at 12 p.m. we have the vaccine update from the Ministry of Health, and later on this evening, 8 p.m. we have the Honorable Prime Minister, Honorable Alan Chasney, giving us an address ahead of the launch of the independence activities that have been slated for this February. My name is Jessie Leonce, signing off for now. Do enjoy the rest of your day. Coming up next, we have Carlton Cyril with the Creole Update.